Perfect. Hey guys, in the virtual world. Good to see everybody. Mr. Hatcher, hey Brian. And Jesse James, in case you forgot. Look forward to seeing everybody back in person one day soon. Miss you guys.
Good morning. Good afternoon, Cary Rotary Club. Welcome to the best looking Rotary Club in District 77 Tech. Yeah, confirmed. After a delay of 7 days, can I please now call on Mr. Rod Brooks to lead us in the prayer and the pledge?
All right, let us pray. Dear Lord, we give thanks for this day and for all the blessings, opportunities, and responsibilities we have as Rotarians. Please help us today to focus on the objectives we have for the world: peace, tranquility, a true brotherhood of man, freedom from hunger, from oppression, from sickness, the freedom to choose our own destinies. We reaffirm our commitment to the simple Rotary 4-way test and our commitment to high ethics in all we do. May we conduct our work as Rotarians with optimism, renewed energy, and a commitment to service to you and our fellow men and women. In your name we pray. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
God bless America. I look forward to the day that we return to our song. All right, can I call on Mr. Tim? Can I call on Tim Mannix to introduce our guests and visiting Rotarians today?
Well, we do have a guest. He's probably, I would call him the Rotarian vagabond. I first ran into this guy who was the president of the Downtown Rotary Club. Then he happened to be one of ours, and he was secretary of this club for a number of years. Now he happens to be with the Raleigh Capital City Club, which I think most of you know. Hello, Ken Tom. Welcome back.
Welcome, Ken.
But I've been in 4 different clubs, 5 different times.
I rest my case.
That's what it is.
Sounds a little like Chicago voting over there. That's right. Renee Spell, represented by that, see that little telephone icon? Wave, Renee. Yeah, Renee is on the line, but she's asked me to let everyone know that the plans for our holiday party, December 7th at Prestonwood Country Club, are being finalized. you should expect to see some correspondence and an invitation from Renee with details about that later this week. So thank you, Renee, as always, for helping to coordinate that. Also, I received an email today from past President Reggie Scales, and he was reminded, you may have received one as well, but it was a reminder that the first meeting of Rotary of North Raleigh's new satellite club, the satellite E-Club, Rotary Club for Entrepreneurship, is Thursday at noon. And so there's Katie Gales, Director of Entrepreneurship Initiatives at Wake Tech, will be sharing some resources that are available. And of course, we're all encouraged to attend. You're aware that there are a number of these satellite E-Clubs emerging. Mary Cam is president of the E-Club for Social Justice. There's also an E-Club focused on the environment and one that's growing for veterans. So it's a great way to sort of have a focused, specialized interest around service if you're interested. So if you didn't get Reggie's email, see me and I'll share some more details about that. David Coulter, you wanted to make a quick announcement.
Very quickly, quick program committee meeting, this table for that.
I missed it. Oh, gosh. Okay. That's a brief announcement. I'm going to take a page from your book, David. Thank you. I spy with my eye our Sergeant at Arms, Brian Reed. Welcome.
So good to be here. So good to be here. And just so you know, he's got to have a seat. It is afternoon. I just want you to know we're a little concerned. I hope thing gets everybody home topsy-turvy. Ken, so good to see you. Don't ever call it homecoming because you're always home with us. Know that. The Traveling Rotarian Award, just now created in your honor, is only $1. It is only $8. Yes, and moving to this table, the best the man can get. The Gillette Award, ladies and gentlemen, jealous of the great facial coverage he has right here. And he just perfectly moved the highlights through it too. I just love how you do that. Thank you so much. So good to see you. And we've got right here before our own eyes, the haircut. Yeah, they go to the same barber, same, is it a 2-blade or 1-blade? It's tight. You get it's a 2-blade. So just $1 for our twins here, the haircut twins at the same table. I tell you what, I felt like I was in Bangor most of Ross and Kristen was looking, even Charlie. I tell you what, with the braces on. With the braces, he's got the matching braces to the tie, he's got it all working on with the green shirt. It's just $1. And folks, never let you, never let anybody tell you that Paisley's out of style, because this man rocks the Paisley long shirt better than anybody in the building right here. So just $1 from this table here, just $1. That's what I'm saying. Yes. Oh, Charlie, thank you. You're always good. Always good. And I heard, we need to see if we can make this happen when we can start singing again soon, that we're going to have a little duet with Tim and Julie here. We're going to get some music going on as soon as we're allowed. Presidente, you got to let us know because we got to start singing again. I feel it. It's coming back. Team Spirit. Who's getting the Team Spirit Award today? Bill. That's right, folks. Bill's getting it, not because of the sweatshirt and the hat. Holy cow, he's got it all going on right there. And for your $1, do you want to make a mention of your beautiful attire today?
Absolutely.
In addition that you voted.
Absolutely. August of 1967, I entered a dorm room at Catawba College in Salisbury. And I met 2 other gentlemen, one of whom I have no idea where he is, but the second one visited me this weekend and we went to our 50th class reunion at Catawba College, celebrated a great time. We had a combination of class of 71 and class of 70. Since they couldn't meet last year, a great time of fellowship this weekend. It was wonderful, and I'm happy to contribute.
50 years later, John, that is awesome.
It was interesting. We asked one of our class members was just on the board of trustees, and we asked him, "Okay, any problem with the Catawba tribe?" And he said, "No, they want us to do this. They want us to do this." So.
Beautiful. Love that story. All right. Since we were kind of on miracle moments already, does anybody else have any miracle moments here? Any other miracle moments? There's got to be some. I heard there's something going on in Dorcas. I heard there's an event that started yesterday.
Absolutely.
Yeah, what about that? Let's hear about it, Howard.
Well,
Since we can't get together for breakfast.
His family's here.
Travis not here. Travis was in the lead for our fundraiser on the first day. He came out of the gate
Wow.
wide open. If you have not chosen to be a table captain, which some of you have, and we certainly do appreciate that, you can go to my page and you can donate as many times as you like. Again, like I heard somebody say, just like home in Chicago, early and often. And we do appreciate it. But this, we are seeing that a lot of the hardship from last year continuing into this year as far as rent, utilities and childcare taking a real steep value. So everything will be very much appreciated. Thank you for your time.
Howard, thank you for all you do for our community. Say give to it feels good.
All right.
Give to it feels good, for sure. Any other miracle moments?
Yes.
Any other miracle moments?
Looks like Blair has one online for a second. Hang on.
So I spent
It's a war, John. It's not.
So I spent the last 2 weeks with grandson and granddaughter in New Hampshire. My grandson is in the 1st grade, and a highlight for me was playing a parents versus kids soccer match. And during this match, one of the kids kicked the ball about 15 feet in the air, and I ran under it and headed it. And some of the kids around me were going, wow, that was great. But not my grandson. My grandson said, Grandpa, you cannot do a header in this division. So that was my miracle moment, getting to play soccer with my grandson.
Speaker, double it up. All right, Presidente, that's all I have.
Thank you very much, Sergeant at Arms. I want to thank you, Brian. It always does wonders for our spirits when we have the Sergeant at Arms here. Doesn't hurt our coffers either. So thank you for all that. All right, well, without further ado then, can I call on Paul Sauceman to introduce our program?
Thank you.
Welcome, Paul.
She had to spend $1 to speak here today. Thank you, Brian. Our speaker today is Julie Henry, and Julie's the Director of Communications and Marketing for AmeriHealth Caritas. That's it, right? North Carolina. Got it. Which is a prepaid health plan offering standard benefit plan for North Carolina Medicaid enrollees. She's responsible for planning, organizing, and managing development and execution of communications, marketing campaigns, and materials for members, providers, community partners, and stakeholders. Julie has more than 20 years of experience in healthcare marketing, communications, and public relations. Prior to coming to the organization I just mentioned before, she has served as an executive leadership roles at North Carolina Healthcare Association and the North Carolina Department of Health and Human Services. Julie has a bachelor's degree from Agnes Scott College in Atlanta, Georgia. She's a longtime resident of North Carolina, and she has served in numerous volunteer roles. She's a member of Cary Presbyterian Church and volunteers to sing in the choir, and also leads the youth group choir when we don't have COVID. So anyway, please welcome Julie Henry.
Thank you, and thanks for inviting me to be here. I was here a couple of years ago when I was with the North Carolina Healthcare Association, which is the association that represents hospitals and health systems across the state. And at that time, I talked about Medicaid. I didn't know then that I would be even more involved in Medicaid now, working for a company that serves the Medicaid population in North Carolina. So I'm happy to be here to talk to you about Medicaid managed care. And I have an able assistant who's going to help me with slides, so you'll forgive me if I pause periodically and say next, next. But I tried to work out a clever motion that I would use, but we haven't quite got that worked out yet. So we'll see how it goes. This is fine for right now. Actually, you can move to the next slide. So this past year, 20 months, I think I was counting this morning, the health focus in North Carolina has really been on one thing, and everybody's been focused on COVID. But there has been some other stuff happening. And in July of this year, a very important thing happened in North Carolina with the transition, or we call it transformation, of the Medicaid program in North Carolina to this new model of Medicaid managed care. So what I'm going to talk about today is a little bit just a kind of a level set about Medicaid in North Carolina, and then also talk about Medicaid managed care and what that means for the people that we serve and what it might mean for you. And then happy to answer as many questions as I'm able after we finish. So you can go to the next slide. Talk a little bit about what Medicaid is. And great, that's perfect. So Medicaid and North Carolina Health Choice, they kind of go together. That Health Choice is the children's form of Medicaid. The Medicaid population serves all ages, but also children. And so they are health insurance programs for children, individuals, and families who are low income and who cannot afford healthcare costs for themselves. Medicaid is jointly funded by the state of North Carolina and the federal government. And in North Carolina, the Medicaid program is administered by the North Carolina Department of Health and Human Services. And I might add that the Medicaid eligibility is really determined by the North Carolina General Assembly. So you've heard a lot about Medicaid expansion, I'm sure, over the past several years. And that decision is up to the states, and our General Assembly is the entity that decides who's eligible for Medicaid in North Carolina. As of October 2021, the total Medicaid enrollment in North Carolina is 2.65 million people. We have over 10 million people in our state. So that's a significant number. And yes, it has increased as a result of the pandemic. And also because during the public health emergency, counties were not doing a process called redetermination as regularly as they had been before. So some people who came onto Medicaid didn't necessarily go off of Medicaid like they might have. So the rules are slightly increased, but not tremendously in North Carolina over what they normally would be. Medicaid managed care standard plans, which is what my organization is part of, serves about 1.65 million of those Medicaid beneficiaries in North Carolina. And the majority of those people who are on Medicaid and not in the managed care setting are in something called NC Medicaid Direct, which means that the state is still administering their Medicaid. And then about 4,000 people are in the ECBI, or Eastern Band of the Cherokee Indians option for Medicaid. They are folks who are part of that tribal entity, and they get their health care in that way. And I just want to add that I really puzzled over kind of how to explain that other almost 1 million people who are in Medicaid and what that population looks like. It is a varied population because there are people who have a variety of different types of physical and mental health challenges, and they are still served by the state because they have very unique needs. And so the state will be transitioning a lot of them into managed care programs, but they won't necessarily be the one that I represent. They might be different tailored plans depending on those individual needs. So Medicaid managed care, which is what I am here to talk with you about today, is a program in which the state selects prepaid health plans, and there are 5 of us, to administer health Medicaid services across the state to beneficiaries. So we call ourselves prepaid health plans, and we get a set amount per month from the state for each member that we serve. AmeriHealth Caritas, that's how you say it, Caritas, serves about 304,000 people across the state. So the state gives our company and the other plans that are part of this program a set amount per member per month. You've probably heard that phrase before when it comes to insurance. And then in turn, we establish contracts with healthcare providers of all types to serve those members that we have. And we also provide opportunities for shared savings, so incentives for those providers to help manage our members' care efficiently and to keep our members healthy. And the last is because our overall goal is to reduce overall healthcare costs for the state and to promote better health outcomes among our members. So I know for me, the words managed care used to be bad words. If any of us lived through the 80s, managed care was not really something that people liked to talk about because it seemed like it was more managed care by denial. And I think a lot of people think of insurance companies as not offering services for individuals. But I think in Medicaid managed care, our goal really is to promote health among our members, because a lot of these folks are people who have not had coordinated care in the past. They have not had a good relationship with their primary care provider, maybe not even had a primary care provider. And so our goal is really to make sure they stay connected and that we provide them with the services they need to get the care that they need. So in North Carolina, just a little history on Medicaid managed care and the road that we've been on to get here. This all started in 2015 when the General Assembly approved legislation to make the transformation from a fee-for-service model for Medicaid, meaning we pay for the services, the state paid for the services people receive, to this managed care model that I've just described. And in 2019, contracts were awarded to 5 plans. So AmeriHealth Caritas is one, Blue Cross Blue Shield has a product called Healthy Blue. Carolina Complete Health is a plan that was put together in the state of North Carolina, but is managed by Centene Healthcare, which is a national company. United Healthcare has a prepaid health plan in the state, and WellCare is another. And in 2020, the move was suspended due to, you might recall that we had some budget issues in North Carolina and maybe not a budget. So we got delayed in our launch, and we finally launched on July 1st of 2021. So the managed care, Medicaid is divided, or the state is divided into 6 regions for Medicaid managed care. The 4 of the 5 plans, excuse me, serve all 6 regions, but Carolina Complete Health serves only 3 regions. The regions 3, 4, and 5, which are orange, red, and purple on the map that you see. And the regions are divided so that they include some of the major metro areas in the state, but also rural areas. And this was just developed by the state, but really to try to divide up the regions so that they were more equal in number and also representative of the variety of people that live in those regions. The largest concentration of members for us and the largest concentration of Medicaid beneficiaries is in Region 3, which is Mecklenburg County, because that is the biggest metro area in our state. We, as a prepaid health plan, have been contracting with providers across the state, and it has been challenging because I'll say, and I can say this because I was on the other side, that healthcare providers were not excited about the transition to Medicaid managed care. They have been always, I think in North Carolina, we're very fortunate that we have a provider community that has been very supportive of the Medicaid program. Lots of providers who participate in serving the Medicaid population, but the transition to managed care was not welcomed with open arms, and the suspension didn't help. So we have been working really hard to contract with doctors, providers of all types, allied health professionals, and hospitals and health systems across the state, and continue to work on those contracts to ensure that we have a really strong network to serve the members that we have been privileged to take care of in North Carolina. Each of us has to maintain a directory on our website so that our members can see the doctors and professionals that they have access to, and that we have an interactive provider directory. And in North Carolina, we have a program, we are in an any willing provider state, which means any provider who's credentialed by Medicaid can contract with any of the health plans. So we don't pick and choose which providers we want to have in our network. If they want to be part of the network, we are happy to have them. As far as our beneficiaries, as I mentioned, we serve over 300,000 people in North Carolina. Of that 1.65 million, they could choose a plan, and we went through an enrollment period, much like we're in the open enrollment period on the exchange right now. But for the transition to Medicaid managed care, individuals on Medicaid got to choose a health plan. If they didn't choose, and I will tell you that the majority of them did not, because they've never been given those options before. So about 100,000 people actually chose a health plan. The rest were auto-assigned to health plans, but got a 3-month period to make a change if they wanted to. So that just ended at the end of September. And individuals could change to a different health plan if they didn't like the one they've been assigned to. We did not see a lot of transition, a lot of people leaving our plan over that period of time. And again, I think a lot of that is just education and not having shopped for insurance, like many of us have had the opportunity to do, either when we bought our own insurance or through our employer choosing which of these plans do you want to pick. Medicaid has always been Medicaid. And so this option to choose is new for a lot of the beneficiaries. They have to, Medicaid beneficiaries who now come into the Medicaid program, a new enrollee in Medicaid, would also get that same opportunity to choose a health plan and to make a change within the first 90 days of enrollment if they are assigned to a health plan. Is there one more bullet on this one? Yes, and finally, as I mentioned, members also must choose a primary care provider. So they choose a health plan, and then once they're in our health plan, they have to choose a primary care provider. And that's something that's new about Medicaid managed care as well, really encouraging those relationships for individuals with their primary care provider. And many of us, I think, who have private insurance or employer-sponsored insurance are very comfortable with that model. We've always had the opportunity to pick our doctor. If we didn't like our doctor, we'd pick a different doctor. But again, for the Medicaid population, a lot of those choices have not been something that they've been accustomed to. So we are charged with really guiding them through that process, helping them understand that if they don't feel like it's a good fit, they can make a change to another primary care provider. And they really need to be in a relationship with their primary care provider so that they can feel confident in the guidance they're being given and in the care that they're getting. So this is just a list. I'm not going to read all these off to you, but these are mandatory benefits federally, the federal mandate for what's covered by Medicaid. So a lot of these may look familiar to you, certainly doctor's visits and hospital care, home health care, and care from federally qualified health centers. But also you'll notice tobacco cessation counseling is a mandatory benefit for pregnant women. And we actually, in North Carolina, it's mandatory for all of our members, and other services there. And then the next slide shows you in North Carolina specific things that are offered by North Carolina Medicaid to Medicaid beneficiaries. The last one on that list is transportation to and from hospitals and doctor's appointments. And I wanted to call special attention to that. We call it non-emergency medical transportation. So all of the health plans have contracts with providers to offer this transportation for members to get to and from doctor's appointments, to and from therapy, and to ensure that that is not an obstacle for individuals in getting the care that they need. And so we talk a lot about social determinants of health, which could be a whole presentation Howard and I could do on another day. All the things that contribute to your overall health, but we find that transportation is a huge barrier for people in getting the care they need. And in fact, I'm just a quick aside, we had a really neat presentation at an employee town hall via Zoom a couple of weeks ago, and one of our care managers said she was talking with a member who had not been going to dialysis regularly. And so she followed up with that individual to find out why and what she could do to help. And the person didn't realize that he could get transportation to dialysis. And she said it's given him like a whole new perspective on his health care, and that now he calls the dialysis center to let him know if he's going to be late and he can get transportation. And so it was really life-changing for him to know that he could get transportation to get the care that he needed, and hopefully will take better care of himself by getting his dialysis regularly. So that was very encouraging. And those are the kinds of stories we really like to hear. And those of us in healthcare need to hear those stories a lot. And so just like getting that individual to dialysis, preventive care is really a top priority. You can click onto all of those. Getting folks in for those regular healthcare that some of us may take for granted. If you're diabetic, getting those regular screenings and diabetic care, because someone with unmanaged diabetes may be in and out of the hospital a lot, probably goes to the emergency department a lot. And, in very practical terms, is very costly to take care of. But in reality, for that person, it's very, takes a toll on them, takes a toll on their health. And so we want to try to keep those people healthy and keep their chronic conditions managed. Also lead screenings for children, it's still an issue. And so making sure that children get lead screenings and well child checkups. And EPSDT really means early intervention for children for any potential issues that they may have that would benefit from being treated early on, like developmental delays or other health issues that children might have. So at AmeriHealth Caritas, North Carolina, care is the heart of our work. And I like that phrase because it helps people remember how to pronounce our name. The word Caritas actually comes from Latin, and it means charity. And so our company has really a strong history in caring for people who have less, who are underserved. We were started in 1983 in Philadelphia by the Sisters of Mercy, who also were really instrumental in forming Mission Health out in Asheville. And since then, we have grown into a company that serves 12 states nationwide and the District of Columbia. And we serve more than 5 million Medicaid, Medicare, and children's health insurance program beneficiaries across the country. And in fact, this year, we are launching the first non-Medicaid insurance product for our company on the exchange to serve here in North Carolina, a population in the Winston-Salem Triad area. This was a requirement by the state, so it's a new, for all of the health plans to have a non-Medicaid product for Medicaid beneficiaries when they, I like to say, graduate from Medicaid, to have a health plan that they could choose that would offer them the opportunity to kind of stay with their same providers. So we are getting started in a small way here in North Carolina, but recognizing that that is really important to offer that seamless transition for people who are moving on with their lives and improving their circumstances, but still want to have those relationships with those same providers. So that's a new role for us. Our mission is to help people get care, stay well, and build healthy communities. And it sounds like that's really close to the Rotary mission of what you all are about, really helping people take care of themselves and ensuring that communities are strong. And then our vision, this is kind of a newly recrafted vision this year. The AmeriHealth Caritas vision is to be a national leader, empowering those in need, especially the underserved and disabled, across their full life journey from wellness to resilience in order to achieve their American dream. And I heard the Rotary pledge sounded a lot like that when someone just said it earlier in the program. But that is looking at all those factors that contribute to health, not just doctor's appointments, but there's so many other things that really play a role in people's overall health and wellness. And so we want to be part of that in North Carolina. And it's very gratifying for me with my background to be part of a company that has such a strong commitment to overall health and wellness. And then finally, I just wanted to talk a little bit about the statewide investment that our company has made. We are of the 5 health plans, we're the only one that didn't already have a presence in North Carolina. So we are newbies to the state, but are really not wasting any time in trying to get out there. Despite COVID, it has put a damper on some of our efforts. But we have a state headquarters in Raleigh. We employ almost 300 North Carolina-based associates across the state, and they are literally everywhere in the state. I just got a chance to see addresses for some of our employees because I was sending them out some T-shirts, and some of those towns I'd never even heard of before, but they're everywhere. So we specifically also have people in each of those regions who are serving, trying to get out and meet community partners in those regions, and also reach out to our members who are there. We will have community wellness and opportunity centers in each region, in the major cities in each region: Asheville, Charlotte, Greensboro, Fayetteville, and Greenville, and hopefully soon Raleigh as well. And those are not wellness centers like the Rex Wellness Center, where you go and exercise. They are, it's more of a community center. And so we'll be doing fitness and cooking classes in those centers. We'll offer health education. Members will be able to meet with a care manager there who can have a one-on-one session with them to talk about their challenges that they're facing, or help them address other issues outside of healthcare. We'll also have community engagement there. So we'll be inviting organizations like Howard's organization to come in perhaps and do programs, or partner with community-based organizations in those communities to come in and help members with everything from job training to parenting classes to a variety of things. And our member engagement director came to AmeriHealth Caritas after almost 40 years at Duke, and she is so excited about all the programming that she's going to be able to offer through those centers, and then from there out into the communities around those centers to our members. So it's really a whole different approach for a population of people who have been underserved and need the extra support to be able to stay healthy and well. And that concludes my presentation, but I'm happy to answer any questions that you might have. Oh, so many questions. Don't make them hard. All right, I'll go to you first.
Thank you, Julie, and great presentation. So why would someone choose your company versus one of the other four?
There are four besides us.
Yeah. So what makes your company unique? Why would someone, if I had a family member who needed to enroll in Medicaid plan, why would they pick your company?
Well, I think on the surface, the plans offer a lot of the same things because, we're really mandated by the state. And there are some things that we have called value-added benefits that some people might find enticing. You might get a credit for helping you build a ramp at your house, or you might get a certain type of programming opportunity available to you. We offer an extra pair of eyeglasses every other year. So we put these little marketing incentives out. But one of my colleagues who came to North Carolina from another state where we had a plan said, give us a year. Once we've been here a year, they'll know who we are and they'll want to work with us. So I think it's really about the relationships and the care management. And, like that story I told you about the woman who shared about the gentleman in dialysis. It's really about that one-to-one care from people who are in the state, who know the services that are available, and connecting people to the services that they might need. So I would say for me, that's probably our biggest selling point. Our strength is in that person-to-person care, really looking after the needs of our members. Yes.
Julie, I agree with John. Great presentation. Thank you for sharing this information. So this is a big shift for the state, and with your company coming in, I'm curious. You spoke to reducing costs as certainly one outcome. Are there specific health outcomes that either you or the state have identified that you're really trying to achieve through this shift?
Yes, and so I realized I probably should repeat the question in case people at home didn't hear, but he asked if there are specific health outcomes that we are being asked to achieve. And the answer is yes. I would say the initial decision to go to Medicaid managed care was very financially driven by the General Assembly, because at the time, Medicaid costs were up and down every year. A bad flu season, we spent way more on Medicaid. And so that was really the motivation. I would say the new leadership at the Department of Health and Human Services, and even more so now with the additional kind of support and encouragement for public health interventions, has really built in some additional asks from the state. So yes, they certainly want us to show health improvement. They want us to show outcomes, and they're going to be monitoring us for those measures in our members. Right now, we have been asked to implement a COVID vaccine incentive program. So every one of the health plans is putting together an incentive program to try to get our members vaccinated. And so that is something the state they've given us some additional funding. So we in turn can offer financial incentives to our members. So that's a very specific thing. We have a program that's coming up called Healthy Opportunities Pilots, which I can't speak to all the details of that, but they are really looking at specific areas of the state that are more underserved than others, and what can we do to try to improve health in those communities. So it really is a partnership. It's not a case of saying, here, take some money, do good things, talk to you like, check in with us every year. The state really is monitoring us very closely. And as a company that has entities and we're in multiple states, North Carolina is probably been the most prescriptive in the Medicaid managed care program of any plan our company's ever been in. Bill?
The access to healthcare is one thing. Accessing healthcare is another.
Right.
What's the gap would you expect of the members of Medicaid that actually fail to access services in a year?
Well, I don't know that I have a hard and fast percentage of the number of people who don't get the services that they need, but I think that I guess I'll answer in a more general way and say that is a challenge that we have been asked to address. So I think that typically the Medicaid budget over the years has been spent, most of it is spent on the highest needs populations. And what that says is, number one, yes, there are people, and I mentioned the beneficiaries that have complex medical issues, but there are a lot of people who have untreated issues that got them to that place. So they are now high needs. And so this emphasis on preventive care, on connecting with primary care physicians, whether that's a pediatrician or a family doctor, that's one of the things that we're being tasked with doing. And so I can't tell you how many text message scripts and letters and birthday cards that I have approved and sent through the approval process to encourage people. It's time to go have your wellness visit. It's time to go have your checkup.
It's a huge mountain that needs to be climbed.
It is, and that's part of this one-to-one. It really requires that connectedness. And I'm sure, Howard, I'm sorry, I keep calling you out, but I'm sure Howard can attest. It really requires sometimes that phone call to encourage people.
One more question.
I'm sorry.
It's important.
Yes, David.
So, Ms. Philly, this is one question, but 3 parts.
Talk really fast. Sorry. Wonderful on the sleeves, okay.
Mental health, behavioral health, prescription drugs, how are they covered? Are they as a
Sure, prescription drugs are covered. We have a sister entity under our umbrella of companies that is a PBM, a pharmacy benefit manager. So prescription drugs are definitely covered. And we work closely with providers and pharmacies to address those needs for members. Mental and behavioral health, that's part of that population of folks. So there are individuals who have severe and persistent mental illness who are still served through the old version of Medicaid, but many people who have behavioral health diagnoses are served by the standard plans. So we contract with behavioral health providers as well to meet their needs, and that's part of that whole care management program.
Okay. This is clearly something we care a lot about.
No, I really appreciate the questions and your interest. And I feel like, it is something that, even if it doesn't touch you directly, it is a part of your life because there are people around you who are being served by this program. So we want healthy communities, and I appreciate your time and your interest.
And we want to say thank you. Of our organization, who also happens to be a very, very wonderful
Jerry
artist.
Mills.
Jerry Mills. Thank you.
Thank you so much.
Julia, I'll add my thanks to your great message, and it's a challenge. So kudos to you and your firm for diving in and being
We'll have you back in a couple of years and I'll tell you about it.
share all the successes. That'd be great. That'd be great. Well, we've got a couple of other great days to celebrate here just before we go. Mr. David Coulter is celebrating his 12th year as a Rotarian on tomorrow. November 3rd. Kevin Peach is not with us today. Perhaps he and his wife Emily are celebrating their anniversary today. And Anthony, very pleased that you're here to join us today. I know that you've got an anniversary coming up. I guess it is Friday for you and Beth. So congratulations. All right, so our program's coming up. Next week, we'll be hearing from Sheila Saya. She's the Associate Director at NC State of the Climate Office, talking about the interaction between humans and water and the climate. Thank you, Pat, for arranging that. And I apologize for garbling what that message is going to be. It's a lot, but I'll do a better job. Pat will do a better job announcing it next week. I have the belief and the reassurance that we'll be back on track with our meal menu. So next week you can expect, but don't count on, chicken parmesan with some rotini and vegetable. So that'll be good. In 2 weeks, Paul will be back up on the program. He's arranged to bring to us Mayor Weinbrecht from the town of Cary. So we'll very definitely look forward to having him with us. I want to thank all of our visitors and guests today. Kent, Julie, for your message, all of you for coming out. and sharing some great fellowship and energy and enthusiasm. So it's fantastic. I want to wish you a great week. If you live in one of those strange municipalities that is having an election today, don't forget to go out and vote. Holly Springs, Apex, Morrisville, Garner, everybody except, I think, is the group there, Raleigh and Cary. But go out and vote. And I'm going to put him on the spot, but I wonder if I can ask Scott Schneider if he'll lead us out in the four-way test. Will you pinch it for us today?
The four-way test of the things we think, say, or do. First, is it true? Second,
Is it fair to all concerned?
Third,
Will it build goodwill and better friendships?
fourth,
Will it be beneficial
to all concerned?
Thank you.